Our medical emergency is cerebrovascular accident or CVA, and it is by Amy, Shanti, Lily, and Michaela.
What is cerebrovascular accident, or CVA? CVA is a stroke. It is the second leading cause of death worldwide. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, which prevents a patient's brain tissue from getting oxygen and nutrients. Within minutes of a stroke, a patient's brain cells begin to die. This is why it is extremely important to act fast when you suspect your patient is having a stroke. Patients who are more likely to have a stroke include patients over 65 years of age, African Americans, younger women who use oral contraceptives who have headaches and who are pregnant, older women due to estrogen associated changes in menopause, diabetic patients, and patients who suffer from atrial fibrillation. There are two main causes of a stroke. The first is a blocked artery, and this is known as an ischemic stroke. Ischemic strokes are the most common strokes that occur. The second main cause of a stroke is a leaking or bursting of a blood vessel, which is known as a hemorrhagic stroke. Signs and symptoms of CVA. First, we'll start with ischemic stroke. There is an altered level of consciousness that ranges from yawning to a coma. Total loss of consciousness is usually uncommon in stroke patients. Confusion, on the other hand, may be common. The patient's pupils may be unequal and dilated. Patients may even present with hemianopia, which means loss of vision in half of the visual field in one or both eyes. Dysphasia, which means impairment of speech, aphasia, which is the inability to speak, and other speech changes can occur in ischemic stroke patients. Dysphagia, difficulty swallowing, as well as drooling, are common symptoms. Weakness, numbness, and tingling in the face often occurs. This can be seen as a facial droop on one side of the face when you ask the patient to smile. Lastly, for ischemic stroke patients is the onset. For thrombotic ischemic stroke, the onset is difficult to determine. On the other hand, embolytic ischemic stroke patients have an abrupt onset of these symptoms. The signs and symptoms for hemorrhagic stroke and ischemic stroke patients are similar. The onset of hemorrhagic stroke patients is usually abrupt and rapid. It begins with an altered level of consciousness, which can range from yawning to a coma. Another sign that can be noticed is your patient may present to be confused or disoriented, have a severe headache, neck pain or stiffness, the inability to walk or stand, as well as nauseous and vomiting. Stroke scales. The CPSS stands for Cincinnati Pre-Hospital Stroke Scale. The scale or survey can be used to help identify early identifications of a stroke in your patient. The scale specifically includes three components that help a dental hygienist identify if their patient may be showing early signs of a stroke. First, the hygienist will ask the patient to smile. If the healthcare provider notices a weakness on one side of the face or a facial droop, then this means that your patient is most likely undergoing a stroke. Hygienists will also ask their patient to hold both of their arms out with palms up and eyes closed for 10 seconds. If the healthcare provider notices a weakness in one of their arms, then this means that their patient is probably having a stroke. However, if the provider notices that there is a weakness in both arms or normal strength in both arms, then the patient will test negative for CVA. Lastly, the patient will be asked to repeat the sentence, "You can't teach an old dog new tricks." This is used to observe if your patient has difficulty speaking. Treatment of CVA. The primary goal in CVA treatment is to minimize the cognitive and physical limitations associated with strokes. If the patient exhibits any signs or symptoms of a CVA, emergency medical services or EMS should be contacted immediately. This is done by person 4 or the office receptionist. The hygienist will use the CPSS to determine and identify the early identifications of stroke in their patient. If one or all three of the components in this survey are found to be abnormal, then a CVA is verified, meaning that your patient is most likely having a stroke. The patient should be placed in a semi-supine position. Person 1 or the dental hygienist that was working on the patient should be assessing the patient's CABs, circulation, airway, and breathing. Person number 3 will be retrieving the portable oxygen tank as well as the emergency kit that is in the office. If the patient is showing signs of dyspnea or shortness of breath or hypoxia, then oxygen should be administered at 6 liters per minute to help relieve these symptoms. Person number 2 should be monitoring and recording the patient's vital signs, as well as the patient's time of symptoms onset. This information will later be relayed to EMS when they arrive. Once EMS arrives, the patient is transported to the emergency department as soon as possible.
In the skit, Amy Taylor is going to be starred as person 1. Keegan is Amy's child and he is the patient. Lily Madrano is going to be person 2, Michaela Cunningham as person 3, and Shanty Mom as person 4.
Keegan, I'm ready for you if you're ready to come back.
Okay,
How are you doing today?
good.
Okay. Do you have any changes to your medical history?
Nope,
No new medication?
nothing.
Okay. Let me record this quickly. Then we will go ahead and jump right in. Keegan, are you okay? Let me set you in the semi-supine. Are you okay? Is it your head? Can you smile for me? Okay. He has a bit of a facial droop. Can you raise both of your arms? Okay. Can you repeat, you can't teach old dogs new tricks? Okay, Shanti, we need to get EMS in here. Tell them that I think we have a CVA and let them know that it's an unaccompanied minor. All right, Keegan, I'm going to go ahead and try to take your vitals right now. All right, check your circulation, airway, and breathing.
Meanwhile, Michaela is getting the emergency kit and portable oxygen tank for Amy. Shanty is contacting the emergency medical service, and Lily is helping Amy monitor and record the patient's vital signs. Okay, Amy, let me know what the patient's pulse is. Okay, you said 90 beats per minute? Okay, and what's the patient's blood pressure? 186/24? Okay, what's the patient's respirations and temperature? Okay, respirations 12, temperature 99.5 degrees Fahrenheit. Thank you. The patient appears to have dyspnea and shortness of breath. Therefore, we need to administer 6 liters of oxygen per minute to the patient. And what time did the onset of these symptoms occur? Okay. I'll give this paper to the emergency medical service once they arrive so that they have all the information that we have here.
Hello, is this EMS? My name is Shanti and I work at the Indiana University Dental Clinic in South Bend. We have a patient here who is presenting signs of a stroke. The address is 1002 Esther Street, South Bend, Indiana 46615. According to his chart, his name is Keegan and he is a 16-year-old male. He does not have any concerning medical information or medical history that would explain his current condition. The patient came in today for normal cleaning. Our hygienist asked him how he was feeling and he said he was feeling well. Our hygienist turned away for 2 seconds to take his vitals and the patient began to have trouble speaking and slurred speech. Our hygienist quickly asked him to smile and hold his arms out, and he showed signs of facial drooping, drooling, and arm muscle weakness. He began grabbing his head almost like he had a headache of some sort. At this point, we have the patient in a semi-supine position in a dental chair. We are just waiting on EMS to arrive. Thank you for your help.
Here's your emergency kit and your portable oxygen tank.
Keegan, I'm going to go ahead and administer some oxygen. EMS is on the way.
EMS is here.
Okay, we'll show them back.
At the hospital treatment. At the hospital, patients suspected of a stroke undergo a CT scan in order to determine the exact etiology of the symptoms. If the CT scan indicates that an ischemic stroke is present and the onset of the symptoms have been less than 3 hours, then the current treatment is intravenous thrombolytic therapy with the medication alteplase. If the CT scan indicates that a hemorrhagic stroke is present, the patient will require a consultation with a neurosurgeon and surgery will be performed.